And she was like, oh my gosh. And he was like, achoo! My nose is really stuffy, and I already feel really tired. I don't think I should play baseball anymore. It's been like this all week. Maybe I should tell Dad. No, I can stick it out. I'm a big girl now. I can't believe she did that. Yeah, me too. Please.
She's safe!
Please. Dad! I think I'm done.
Dang, blood? Aw, there, Melody. You did great. I'm really thirsty. Is there water anywhere?
Dad, I need tissues. My nose is stuffy.
Aw, here you go.
I can't get out. Can you help me?
Wow, it's really sticky. Blow for me? Got it all.
Dad, it's back.
I'll substitute you out. Look, I'll book your doctor appointment for next week. We'll cancel if it gets better.
Dad, it really hasn't got any better. And sometimes I cough up blood too.
Oh, we're here. Hi, I have a 1:15 appointment for my daughter.
Melody? Oh, alright. I'll just need her health card.
Here you go.
Alright, just have a seat.
It's 1:10 already, so just 5 minutes.
Melody, follow me. Room 9.
These wait times are unacceptable. Hi, everybody!
Hi, Dr. Chavocado.
Please don't rip the paper.
Sorry.
It looks like they forgot to weigh you in. Step on the scale for me. Okay, and don't move. Done. You've grown so much. How have you been?
It's been okay. School is easy, and I'm doing well at baseball.
That sounds great. What's bothering you today?
Well, it all started 2 weeks ago. I started coughing randomly and having a constant stuffy nose, but it was 30 degrees all week. I've always been good at gym class, but this week, anytime I start running, I just start huffing and puffing and coughing.
Is the huffing and puffing squeaky?
Yeah, and every time I cough, more mucus comes out.
Let me see the color of the mucus. It's yellow. This is a sign your body is fighting an illness. Don't forget the blood.
And sometimes I cough out blood too.
Melody, can I look up your nose? Look up for me. Looks red and swollen. How severe are your symptoms? Do you feel any pain when you cough?
Whenever I talk, it hurts. My nose hasn't been well since this all started.
Now, I want to ask you about changes. Has there been anything that makes these symptoms come and go? Have you started eating differently?
Every time I try to do something, I just start coughing, and it's not fair.
Her diet hasn't changed at all. I oversee the nutrition. Has she had any other illnesses recently? No, not since last winter when she got the flu. No vacations either?
I wish.
Most of these symptoms, such as coughing and mucus, could happen to anybody who's sick, but the fact that this has been going on for 2 weeks makes me worried, as well as the bloody cough. There's a rare condition associated with this. Mr. Ao, I'm gonna ask you a weird question. Does it taste salty when you kiss Melody? Now that you think about it. I'm really thirsty. Is there water anywhere? Every time I kiss her, it's made me drink water. Let's find out.
Dad!
Yeah, that's salty, alright. Mr. Ao, are you aware of any families with symptom of coughing like hers? My dad would constantly cough at thick mucus all his life, but he was a lifelong smoker, and on my in-law side, I haven't asked a lot. Thick mucus, you say? You see, now I'm thinking of cystic fibrosis if your dad has these same symptoms, because that's an inherited condition. But me and my wife don't have any of those symptoms. You see, cystic fibrosis has an autosomal recessive inheritance pattern. If one of your cystic fibrosis transmembrane conductance regulator CFTR genes has an atypical allele or type, but the other one is normal, you won't show any symptoms, but you'll be a carrier. If your wife is in the same situation, you have a 1 in 4 chance of having a child who inherits 2 atypical genes. Since this condition is recessive, it means that for the condition to show symptoms, the child must have 2 atypical genes, which only has a 25% chance of happening. So it's caused by her genes? Yes, and I'm going to order a genetic test from a blood sample. What will happen is someone will take blood from a vein in your arm with a needle.
A needle?
Only around 3 milliliters. You'll get a bandage and a lollipop after. The test is needed to see if your CFTR gene has a normal allele or 2 atypical alleles. A centrifuge is used to separate blood components. It's like a really fast spinning washing machine. Then, we'll look at your white blood cells to test the CFTR gene in your DNA and identify your alleles. Sounds good. All you need to do is bring a requisition form, which you can pick up at the front, and your health card. To prepare, you also have to fast for 8 hours, and you cannot drink any sugary juice or soda.
8 hours? But I'm gonna be hungry!
That's why most people start fasting at night, such as 8 p.m. And by the next morning, as long as they don't eat breakfast, they're good to go for the blood test. Also, you can't do exercise before the blood test, as it may simulate the digestive system and alter the results. You can take this fasting guide with you. Sounds good. I just booked an appointment for next week. Yep, they'll send me the results. Any other questions? This is all covered by OHIP, right? Yes! Ordered blood tests are covered by OHIP. Thank you.
Thank you. Bye-bye.
Bye, everybody! Hi, I have a 3:30 appointment for my daughter.
Oh, Melly Al? Alright, I just need her health card. Alright, just have a seat. Achoo!
3:25. It's gonna be a long wait. I'm gonna get some work done.
Melody, follow me. Room 9.
Never mind. Hi, everybody. What's wrong? So, here are the results. Melody has the recessive CFTR gene.
Huh?
The report tested gene NM_000492.4 and found at DNA position 1652, a guanine was replaced by an adenine, which is what C.1652GA means.
Does this mean something's wrong with me? I want to go home.
Don't feel that way, Melody. It can be hard to accept, but it's very important we discuss how this affects you so you can protect yourself from symptoms. Firstly, let's talk about what caused this. Cystic fibrosis is genetic, meaning there's nothing you could have done.
Then why is it only affecting me now?
Cystic fibrosis gets worse throughout your life, and symptoms may start appearing at any time. It's really random.
It's gonna get worse?
Not if we treat it early, but if we don't treat it, here's some images. Cystic fibrosis, or CF, prevents the entry and exit of salt and water in cells, making mucus thick and sticky. It also makes her saliva, which contains mucus, salty, which is why I asked if her kisses were salty. If mucus gets sticky, it stays in the lungs. This gives bacteria and fungi a place to live. This irritates the airways, and the smooth muscle tissue gets thicker. The airways become smaller and more blocked, reducing airflow. When you get less oxygen, you get more tired. This explains what happened in gym class. You might also get nasal polyps since your nose will be irritated, kind of like bumps in your nose.
Is that all?
No, it does a lot more. The inflammation scars widens the airway, leaving more room for mucus to build up and infect your lungs even more, making the whole problem worse. This is called bronchiectasis. Every time you exercise, you will experience exacerbations in which you cough and produce even more mucus, as happened at baseball. If you do exercise, since your cells are worse at taking in water, you will be dehydrated and will need extra water. If the mucus damages the lung tissue for long enough, it can cause life-threatening respiratory issues where your body doesn't get enough oxygen.
Am I gonna die?
No! Let's talk about the treatment. The median life expectancy with CF is 65 years now, meaning more than half of the people with CF will live past 65. Even though there is no full cure, we can stop most of the symptoms. There are medicines that improve how the CFTR protein works. These are called cystic fibrosis transmembrane conductance regulator modulators. The most important is trikafta, which uses elixacaftor and tezacaftor to move CFTR proteins to the top of the cell. Then, ivacaftor opens the CFTR proteins, allowing chlorine to enter and exit. It's considered one of the most groundbreaking achievements in cystic fibrosis treatment and doubled the life expectancy. Hypertonic saline can thin the mucus, but you have to use a nebulizer to inhale it. It's kind of like a big face mask. Lastly, you can use a bronchodilator to open your airways, especially when doing exercise. This makes the muscles in your bronchi relax and lets more air pass. In other words, you can still do exercise, even baseball, but remember to drink and take breaks.
I'm so scared and sad, and I feel alone.
Cystic Fibrosis Canada runs virtual support groups you can sign up for, where you can learn more about living with CF and meet others with it too.
Thank you.
And is this all covered by OHIP? Yep! Before Chicafa was covered in 2022, you'd have to pay $300,000 per year out of pocket. Phew, don't have to sell my house today. I'll send you an email detailing all the information for Chicafa soon. For now, here's the prescription for a bronchodilator.
And I was like, you can't do that. But she was like, yes, I can. And I'm like, no, you can't.
Melody, you're next. She's safe. Here you go, sweetie. Nice hit, Melody.